My name is Carissa Judge. I'm from Rock Valley, Iowa. Last winter I was playing volleyball in our women's league and I went to do an approach and I did my slide approach, came down on just my left knee and I felt my whole knee do a zigzag. So I knew it wasn't good right from the start. Got in, had an MRI done, and I tore my ACL in a clean break, which allowed me to be part of a study called the BEAR procedure, which stands for Bridge Enhancement ACL Repairment. And so that's more natural for your knee to repair it rather than to reconstruct it. So with this BEAR procedure, they take this piece from a cow, they inject your blood into it, and then they stitch it between the two stumps of your ACL, and that forms a blood clot there, which then in turn forms into your ACL. Everything this study they did up to before humans have proven to be just as strong as your normal reconstructing of your ACL. And so hopefully that pans out to be the case here in 10 years from now when I hopefully I'm still playing sand volleyball and golfing and running around with my boys at home. So the pain typically can be more painful in your knee because you're hurting another part of your knee. But with the BEAR procedure, you're just affecting your ACL, and so then the rest of your knee is still as normal as it would be before. And so I have not had any pain. Maybe the first day after surgery, but outside of that, I've really had no pain with my knee this whole process, which has been a blessing. So I liked the benefit of this procedure because it's more natural for my knee. That was a big push for me. That was one of my big marks. And just because then you're not damaging another part of your knee, which hopefully in turn will allow your knee to be stronger in the future. I'm 6 months out post-surgery, but I would highly recommend the BEAR procedure to anybody that is a candidate for it. I've had great luck with it so far. My therapy has been pretty painless, and any type of tear in your body is going to take time, and that can be the most frustrating thing, is just that time that it takes to get that strength back up. But I've with no pain, and my knee feels great. I feel like I can do about anything, and I've been very happy with the procedure and the recovery that I've had so far post-surgery.